Psychotherapy of Preoedipal Conditions by Spotnitz, 1976. Emotional Induction in Psychotherapy, in brief. This brief summary on the themes and important ideas regarding emotional induction, particularly within the context of psychotherapy, drawing from the provided excerpts of Emotional Induction by H. Spotnitz, 1976. Core concept, emotional induction. Emotional induction refers to the phenomenon where the presence of emotions in one individual significantly influences the emotional state of another. This is presented as an unconscious and constant process among human beings, although the specific conditions under which it is most potent remain largely unknown. Social and mass behavior. The text notes that social psychologists such as McDougall, 1924, have studied this phenomenon to understand social and mass behavior, highlighting its pervasive nature. Psychotherapy's overlooked aspect, despite its widespread occurrence, the significance of emotional induction for psychotherapy has received little attention. Freud discussed thought transference, but not the interpersonal transfer of emotions. Brill, 1949, explicitly stated, of course, emotions beget emotions, page 224, and observed how strong emotional effect could rouse patients from a congealed state, page 219, but did not explore its implications for ego formation. 2. The value and organization of emotions. Emotions are presented as crucial for human functioning and adjustment. Facilitating behavior. Behavior is facilitated by compatible emotions. A rich supply of compatible emotions eases adjustment and enables spontaneous, well-functioning behavior. Impulses versus discharge. A critical distinction is made between impulses toward emotional discharge and actual emotional discharge. The experiencing of an emotion appears to coincide with the acceptance of an impulse toward emotional discharge. Conditions for shared emotion. Individuals experience the same emotion if they share the same impulse and the same attitudes about discharging it. If these attitudes differ, even with similar impulses, dissimilar emotions or the absence of emotions may result. Inhibited impulses. Impulses that are inhibited become intensified. This has significant implications for understanding psychological distress. 3. Clinical manifestations and illustrations. Emotional induction occurs in various clinical scenarios, often outside conscious awareness. Awareness of source. Sometimes, individuals are aware of the source of induced emotions, as illustrated by the 12-year-old girl who naively remarked, "I caught my fear of mice from my sister." She perceived emotions as contagious, in the same way as a contagious disease. Unaccountable feelings. More frequently, the individual is unable to account for it, as seen in the young man who felt too disagreeable to be nice to a woman without knowing why, only to discover later she had a similar negative reaction to him. Group therapy dynamics. Members of therapy groups react to one another's emotions, often being governed by the emotional attitude of the preceding speaker. Varied reactions to same induction. The same emotional influence can elicit diverse responses depending on individual internal states and defense mechanisms. For example, when reproductive urges unconsciously dominated a group session, one girl dreamt of a baby, others verbalized sexual fantasies, while another responded more maturely by expressing a desire for a real baby and a history of caring for infants. Analyst and Alisand Diad, the therapist's emotional attitude can significantly influence the patient. When the author conveyed a feeling of self-restraint through prolonged silence, 6 different reactions were observed, ranging from delight and feeling free to do nothing to interpreting it as anger, lack of interest, criticism, or even provoking a tense verbal outburst of hostility. These reactions were often rooted in past experiences, such as the woman who felt criticized because her mother's silences would end with some expression of disapproval. Relevance for schizoid/schizophrenic patients. Emotional induction is an important factor to bear in mind when one is treating schizoid or schizophrenic patients, as they sense the therapist's emotional attitude and may react to it with compliance or defiance. A schizoid man, perceiving the analyst's unstated desire for him to talk, defiantly remained silent, luxuriating in the absence of pressure as permission to do as he pleased. 4. Reciprocal induction and therapeutic implications. Emotional induction is a reciprocal process in analytic therapy, meaning both patient and therapist influence each other's emotional states. Transference and countertransference. As the patient develops transference, the therapist develops countertransference based on unconscious reactions to the patient's transference attitudes and behavior. Therapist's role. The effectiveness of therapy hinges on the therapist's ability to feel the patient's tendencies toward instinctual discharge and sense his latent emotions and help him feel them. This capacity ensures the relationship is grounded in genuine emotional understanding rather than being merely an intellectual exercise. Dealing with latent emotions, patients often have no intimation of their existence regarding latent emotions, and their ego may not function when exposed to them. Symptoms serve as defenses. The therapist helps patients feel them gradually and guides their discharge in language by working on the defenses. This process leads to more spontaneous and egosyntonic discharge patterns, diminishing rigidity and increasing flexibility. Partial gratification and ego development. Integrated ego functioning requires impulses to be only partially gratified. Patients need to gradually become aware of and sufficiently restrain impulses so they become emotions, the driving fuel of the ego. An evolving ego continuously uses primitive impulses for emotions to perceive and react to external situations. Managing aggressive impulses. The damming up of aggressive impulses causes the most dangerous disruptions of personality functioning. If patients feel these impulses intensely, they inhibit them, leading to destructive emotions in themselves and stimulating aggression in others. Rapid verbal discharge of negative feelings is crucial to prevent destructive behavior in the therapeutic situation. Fostering positive emotions. If positive impulses are mutually induced, they lead to mutual affection and a cooperative relationship. Limiting the discharge of these positive emotions to language will intensify these emotions, and the stronger the emotions, the more energy they will command for pursuing their common purpose. Maturation of Preoedipal personality. Recognizing emotional induction facilitates the maturation of the Preoedipal personality. This involves neutralize ing negative impulses by helping the patient discharge them in language, and induct ing healthful feelings by positive impulses in the therapist. Channelization and action. The ability to channelize primitive impulses in socially desirable ways is key to psychological health. Therapeutic leverage. A psychotherapist who can sense the patient's impulses to action and recognize the impulses/emotions they induce in themselves can use these induced emotions as an additional source of therapeutic leverage to resolve resistances, especially in severely disturbed patients. Preverbal problems. Emotional induction is particularly important for patients with preverbal problems whose aggressive impulses need primary attention because they may develop into physically destructive patterns. These are neutralized by helping the patient discharge them in language. Therapist's positive influence. The therapist's positive impulses can induce healthful feelings in the patient and helps the patient channelize his destructive impulses into emotions which can be regulated. 6. Conclusion. Therapeutic potential and challenges. The text argues that inducing specific, absent emotions in a patient might well be accepted as an essential aspect of the psychotherapeutic endeavor. However, its application is not easy, requiring careful and prolonged therapeutic work. Considerations of timing and the appropriateness of one or another mode of functioning are vital, as is recognizing and controlling the possibility of inducing unhealthy emotions.